The broad changes spanning across business and healthcare amid the global pandemic will undoubtedly alter standard practices post-COVID-19. One America's Jenn Pellegrino has more.
Adam Hardage, CEO and co-founder of Remote Health Solutions. Thanks so much for joining us today.
Absolutely. Thanks for having me, Jen.
Yeah, it's great to see you again, Adam. So as a small business owner, I know that you are a strong advocate of reopening the economy. The president announced yesterday that phased plan.
Yeah.
You live in the state of Virginia, where the governor has closed essentially all non-essential businesses until June 10th. What's your take on that?
I just think it's a little bit irresponsible what Governor Northam has done. But I am absolutely a fan of getting the economy reopened because I don't think that there's a one-size solution for everything. Just because New York City in a high-rise may have a certain problem does not mean that the farmer out in the country has the same threat or problem, and he still needs to get food on the tables. So I'm a fan of responsible opening.
And Adam, we were chatting earlier. You mentioned that your company had applied for the small business loan.
Mm-hmm.
Tell us how that went.
Well, to the best of our knowledge, we will not be getting one. I guess all the money has run out. And so at the end of the day, you've got the Democrats holding the rest of the country hostage as the Republicans have tried to bump up the amount of funds available. And as long as we give them the Green New Deal and all kinds of other crazy things that the Democrats want, maybe we'll be able to bail out small businesses. If not, then I think Nancy Pelosi and Chuck Schumer are going to hold the country hostage. And that's really a shame.
I know you're sitting in your office right now that's currently empty behind you. You said you're the only one in there.
Yeah.
How do you think this new normal that we're in right now is going to change the future of your business as well as others across the country?
Well, it's an interesting question. From our business perspective, I happen to run a telemedicine company. So when this thing hit, and ever since then, we've been running almost 24/7, busy, trying to grow and support and help and alleviate as much stress on the medical infrastructure around the country as possible. So it's, sadly, it's good for our business, but I also have a lot of colleagues that are just hurting big time. We're talking 40-60% of payroll employees laid off. I've received probably 50 resumes in the last week from healthcare workers who have been laid off. Now, that's ironic.
That is unusual. Healthcare workers in a time when we need them more than ever.
Mm-hmm. Well, it's very interesting because my chief medical officer is a practicing ER physician. And his report from the front lines is that, the ER is generally quieter now ever since coronavirus because people just aren't coming in. If they don't have to, then they're absolutely not going to come into the ER. But those patients generate revenue, and those buildings, those hospitals, those ERs need that revenue to stay in business. So when they don't get that kind of business, or when you have somebody who's like an ear, nose, throat specialist or some other non-COVID related provider, then when patients don't show up, they can't keep the doors open.
I'm sure you never would have imagined, Adam, that telehealth, telemedicine has grown as quickly as it has in the last few weeks here. Is this going to be the new normal in medicine as we proceed forward?
Yes, absolutely. This is medicine of the future is here now today. I don't see people going back to the old school in-office visit, and I think practitioners are going to have to get on board with it. The modern technology is here. So with our company, we can conduct a complete virtual exam from anywhere on the planet. So we do it for the military, we do it for the chronically ill Medicare patient population, and the technology is here, so why not use it? We can handle most things via telemedicine.
Adam, we are very grateful for all that you and your team are doing. Hope that you continue to stay well, and hoping in the future that these Skype interviews won't be the new norm, because we'd love to have you in studio sometime.
Thanks, Jen. I really hope so too. I look forward to that day, and I got to tell you, it's going to be a happy day for everybody when we all get together again. So
it sure will be. Adam Hardage of Remote Health Solutions, thank you so much.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.